I want to share with you the full story of the blood clots that I've had, how they happened, what the symptoms were, how they were treated, and basically how they've affected my life. If you've had a blood clot yourself or know someone that has, maybe you can relate. The story goes all the way back to 2017. Back then, I was kind of experimenting with the idea of living in my car because I was big into rock climbing at the time, and the dirtbag van life lifestyle is often integrated into that community. Anyways, I always wanted to make this little lifestyle experiment happen, so I had to figure out a way to actually sleep in a Honda Civic. The back seats didn't fold down completely flat, so for a little while, I simply tried sleeping reclined in the driver's seat. After a few days of that, I tried sleeping on my side in the back seat. Now, as far as blood clots go, these were probably terrible ideas because it meant that my legs would either be below my heart level in the front seat or sharply bent at the knee in the back seat for 6 to 8 hours at a time. One day, I'm in the rock climbing gym doing a bit of climbing and yoga, and this was the first time that I noticed my left calf muscle feeling a little bit tender or achy. It was very subtle. It kind of felt like it was bruised, or maybe I had strained some kind of tendon or something. Nothing painful, it just felt like it needed to be stretched out. I wasn't climbing aggressively and I didn't fall on it or anything, so I wasn't sure why it felt the way that it did and why it was just in one leg. Over the next couple of days, the feeling kind of comes and goes. I try to do the usual stuff like stretch it out, ice it, massage it, and just rest basically. But as the days go by, I notice that the feeling is very particular. Like it's not over the entire calf muscle, but instead it's localized to like one pinpoint spot at the top of my calf muscle, right where it meets the back of my knee. The sensation that I feel is kind of similar to the feeling that you might get right before you get a Charlie horse or a muscle cramp. So I start looking on the internet for some useful information. I don't remember exactly what I searched for, but it was something like strange achy feeling in my left leg. Suddenly, I'm reading all of these articles about blood clots and this thing called DVT or deep vein thrombosis and how it's super dangerous and you need to go to the emergency room if you think that you have one. I'm kind of relieved though when I learned that the usual symptoms of a DVT are things like redness, swelling, pain, or warmth, and I have none of those things. But over the next couple of days, I'm noticing that the feeling is getting more intense, and now it's lingering throughout the whole day. So I'm still kind of on edge, and I'm thinking of going to the hospital. Finally, one day I wake up and that tingling, subtle, achy feeling that I had is now actually painful. Like it hurts when I put any weight on my left leg at all. I don't feel like I'm dying or anything, so instead of going to the ER, I end up going to urgent care. Here's a tip for you if you ever think that you have a blood clot. I was getting checked in and I told the hospital staff that I wanted to get my leg checked out. So they signed me in and told me to take a seat. But after I was waiting there for a while, I went back up to the window and I told them, I want to know how much longer it's going to take because I think that I might have a blood clot in my leg. Now, I didn't want to lead with that in the beginning because I didn't want to come off like I was self-diagnosing. But anyways, once I said that, the lady immediately says, oh, why didn't you tell us that in the first place? And then they check me in and like get me into the next stage right away. So if you ever think you have a clot, just lead with that. So I'm getting my blood pressure taken and the nurse is telling me that I'm probably fine because I look too young and too thin to have a blood clot. The first test they do to actually detect a clot is a blood test called the D-dimer. This is a quick, easy, and cheap test that looks for certain proteins in your blood. If the results are normal, it's very unlikely that you have any kind of clot. But if they're high, it means your body has recently been breaking down a clot, which would be suspicious if you're not currently injured. Well, a doctor comes in and tells me that the results are high, but that this test by itself is not conclusive. So in order to confirm whether there is a clot or not, I'll have to go and do an ultrasound test so that they can visually look inside my leg and see what's going on. He also mentions that I shouldn't worry too much because I'm very young and fit, and in all likelihood, they won't find anything. So I get the ultrasound, and as I'm waiting for the results, the technician tells me that I'll probably be fine because I'm young and I look too healthy to have a clot. Well, as you probably can predict, the doctor comes in after the test and tells me that I do have a blood clot in my leg. These were the next steps. A nurse comes in and gives me an injection in my stomach of this blood thinning medication called Lovenox. It's stronger and it acts faster than other medication that comes in pill form. And so they do this while you're still in the hospital so that they can make sure that your condition is stable and that you're safe. I was then given a prescription for 5 needles and syringes of Lovenox and taught how to inject myself at home. After the initial 5 days, I could then start taking a prescription of pills called Pradaxa. A quick side note about blood thinning medication. It doesn't actually dissolve clots. What they're used for is to prevent existing clots in your body from growing any bigger, as well as to prevent them from breaking off and making their way up into your lungs or other organs. This basically buys your body extra time to dissolve the clots through its own natural processes. Okay, so I take the medication for 3 months, and then I take a blood test, and I find out that I'm clot-free. Now, one of the tricky things about blood clots is that once you have one, it's fairly common for people to have similar feelings and sensations in their body that makes them think that they have another one. Well, one time I'm sitting in my office chair at work when suddenly my awareness goes to my left leg, and I think that I feel that same very subtle achy feeling in my calf muscle. And so eventually, just to be safe, I take myself to the hospital and get it checked out. They do the blood test, and then a doctor comes back and tells me that they actually didn't find any signs of a clot. And what I'm experiencing is more likely just a result of the stress and anxiety that I feel after having gone through everything in the past and thinking that it might happen again. So basically, she says that it's in my head. Okay, now let's fast forward 7 years to 2024. I'd been clot-free this whole time and made it a point to take measures to reduce the risk of future blood clots. Anytime that I'd be driving long distances or flying in an airplane, I'd always make it a point to get up and walk every couple of hours, or at the very least, while I'm seated, flex my feet and my calf muscles. I'd also take a low-dose aspirin anytime I was going to be traveling over 2 hours. Well, in 2024, I was traveling a lot. I started the year by flying from the US all the way to Romania. Then I flew back to the US for a bit before going even further to Bali in Indonesia, then back to the US again before taking a family trip to Hawaii. Just like always, I tried to get up every couple of hours to stretch my legs and took a low-dose aspirin at the beginning of the flight. A quick side note about aspirin. From what I've learned, it can help to prevent certain cardiovascular issues to some extent, but it works differently than the medication that you're prescribed in order to actually heal from blood clots. All this is to say that aspirin is simply not a perfect replacement for the medication that's used and designed specifically for blood clots. Okay, so 2024. I had gotten back from a family trip to Hawaii, and like I mentioned in one of my recent videos, I had gone on a very short run with a brand new set of running shoes. Shortly after that, I started to feel that subtle, crampy feeling in the back of my leg. But I figured that in all likelihood, it was simply from running in new shoes that hadn't been broken in yet. Well, the next day, this feeling lingers into the night. It's about 1 a.m. and I'm lying on the couch when suddenly this thought pops into my mind. Maybe this isn't from running. Maybe it's a DVT. I realized that it feels so similar to the feeling that I had back in 2017. It's the same leg and it's directed into that one particular point, deep into the tissue at the top of my calf. Just like before, there's no noticeable swelling, redness, or warmth. But I take a full dose aspirin just to be safe. At this point, I still didn't know that aspirin isn't a fix for a possible blood clot. I drank a bunch of water, and then I wrote a little note to myself on my phone to document what I was feeling before going to sleep. Looking back on this note, apparently it was 7 full days between the time that I documented it to the time that I eventually took myself to the emergency room. And this is an important lesson right here, which is that if you have any kind of concerns about your health or an injury or just something that you suspect is going on in your body, document it. Document the day, the time, what you were doing, even things like if you had eaten a regular full meal during the day or if you did a really hard workout earlier in the morning. Document anything that could possibly help you or your doctor investigate into what's going on. So I go into the ER, I tell them that I have a history of DVT and that I think I might have one again. This time they skip the D-dimer test and just go straight to an ultrasound. Of course, as you can guess, it comes back positive for what's called a non-occlusive clot in one of the gastrocnemius veins. Basically, it's a clot that's only partially blocking one of the deep veins at the top of my calf. I'm given medication, but for some reason, this time they skip the Lovenox injections and just give me a new set of pills called Eliquis. I'm actually still a little confused as to why they did that, because again, the purpose of doing the injection is that your body gets an immediate dose of anticoagulant medication. While pills are cheaper and much more convenient, the downside is that they take a few days before they're working at full effect in your body. Okay, so I just had the DVT, and a couple of days later, I'm lying in bed one night, and suddenly I'm feeling lightheaded with this cold, uneasy feeling in my body. Again, I'm just lying there, not really doing anything except looking at my phone, so the randomness of it is really concerning. I'm trying to remain calm because I am aware that it's possible to make yourself think that things are worse than they really are simply because of fear and anxiety that you have. I give it a good 20 to 30 minutes before I tell myself that it just wouldn't be wise to try to sleep through something like this. So I go to the ER. When I get there, I tell them that I have a DVT and that I was feeling lightheaded. They check all my vitals, inject a colored dye into my arm, and then put me into a CT scan so that they can take images of my lungs. When the images come back, they tell me that I have a small clot in one of the smaller branches of my right lung. They give me an injection of Lovenox and admit me into the hospital where I stay overnight. I don't sleep at all, but in the early hours of the morning, they do an EKG test to see if the clot is putting any strain on my heart, an ultrasound of my chest, a blood test to check for genetic factors that may be causing the clot, and another CT scan to look for any issues in my brain. Fortunately, everything except for the actual blood clot seems to be in good shape. So a hematologist comes in and we talk about the next steps. He says that the blood clot in my lungs, which is called a pulmonary embolism, could have been there when I first came in for the DVT. It could also be because it takes a few days for the blood thinning pills to actually take full effect. Or it could possibly be that my body has some kind of resistance to Eliquis. I tell him that I actually have another trip to Hawaii coming up in a couple of days, and I'm already set to go. I've got my ticket and everything for it. So I ask him if he thinks it would be safe to go. He said it would be safe as long as I'm on blood thinners, but just to rule out the possibility that maybe I am resistant to the Eliquis medication, we both agree that the wisest thing would be to opt out of the pills for a while and instead have a month's supply of Lovenox injections, since I already know that those work. Now, for anyone that's had a blood clot before, I'm sure you can relate to this next part. I'm in Hawaii, and there are at least 2 occasions where I'm pretty worried that I feel another clot. But I also know that it's normal to have these lingering feelings while you're healing and taking medication, so it's really difficult to know if I should continue being worried or just rest. This is the ongoing stress of having a blood clot. Okay, so we're almost all caught up with the story. The last major thing that happens is when I come back from this trip. The night after Christmas dinner, I'm driving my grandfather home when suddenly I feel this numbness come up my left arm, up my torso, and then along the left backside of my neck and my head. It also kind of feels like my blood pressure and heart rate is changing a little bit, but I'm not sure if that is because something bad is happening or it's just from being freaked out. So I remain calm and just try to breathe into it. My grandfather has his own health problems, so I don't want to freak him out and drive us to the hospital. So I drop him off at home and I go home as well and just kind of sit with and observe all of these feelings. Again, it's very subtle and it's not a clear emergency, but it is specifically in one side of my body, which naturally makes me think about things like heart attack or stroke. But I'm also not exhibiting any of the typical symptoms that you associate with those things, like, your face drooping, weakness in your arm, or an inability to speak. Now, one thing that I haven't mentioned yet is that when I took the blood test that night that they found the clot in my lung, they found that there actually is a genetic reason that I've been having these blood clots. It turns out that it's something called a prothrombin G20210A mutation. It's a mutation in the DNA of the prothrombin gene, a gene that plays a key role in clotting, where guanine G is replaced by adenine A at position 20210. I mention these little details because I thought it was actually kind of cool that high school chemistry class has actually played some kind of relevant role in my life. Anyways, this genetic change makes my blood more prone to clotting. The last little nerdy detail of all of this is that, fortunately, I am what's considered heterozygous, which means you have one copy of that mutation from just one of your parents. The other option is that you could be homozygous, which means you have two copies of the mutation, one from each of your parents. In my case, being heterozygous, it means that there's a 2 to 3 times greater chance that I'll have blood clotting issues compared to the average person. Whereas if I was homozygous and I had 2 copies of those genes, it would mean that I'm like 10 to 20 times more likely to have blood clotting issues than your average person. Okay, so combine all of that with the knowledge that on my father's side of the family, we've seen someone endure multiple debilitating strokes in their life, as well as my grandmother who, before I was born, died of a brain aneurysm on her birthday. So the idea of being incapacitated or dead in an instant on a day that's supposed to be joyful and carefree was definitely not beyond me. So, with this feeling still kind of coming and going, the next afternoon I checked myself into the ER. They did an EKG, a blood test, and a CT scan of my head, and thankfully everything looked normal. And so here we are. It's been about 3 months since the most recent DVT. I'm still on blood thinners, and I think I will be for the rest of my life. That thought actually made me really sad because I had recently been pushing myself to really live a more holistic lifestyle. Like if you go and watch the video that I made about the off-the-grid farm experience that I had in Hawaii, I talk about how amazing it was to be eating organic, whole foods with no additives, drinking super clean, double-filtered water, and just spending so much time in nature. And now it seems like I'll have to put some kind of medication in my body every day for the rest of my life. But overall, I feel fine. I still have doctor's appointments to go to. There's apparently some kind of higher level of liver enzymes that I'm producing, maybe because of the medications. I've taken a couple of blood tests in the last 2 weeks. And so it's just this ongoing process. But this experience has also been very eye-opening for me. I've also been learning a lot from these amazing podcast episodes and interviews that I found on YouTube that's created by this nonprofit organization called the National Blood Clot Alliance. And they basically interview doctors, patients, and their whole mission is about raising awareness and providing support around the topic of blood clots. I'll put a link to that in the description of this video and in my bio. So definitely go check that out if you've been dealing with a blood clot of your own or you know someone that has. Anyways, thank you for listening to my story and be well.